Hi, I'm Courtney Herring, and I'm a co-occurring therapist here at Worcester Youth and Family Counseling Services. September is National Recovery Month, so I decided for my topic this week to choose something related to addiction. I wanted to choose a topic that was both inclusive for the addicted person as well as family and support members, because it's really important for both sides because addiction affects multiple people. So I decided to choose stages of change. And the stages of change model can be utilized with any change such as weight loss. It can be just general like goal-oriented situations, but it's really, really beneficial for addiction in particular. So the stages of change model starts with pre-contemplation. So pre-contemplation for the addicted side is that this person has little to no insight into the problem behavior. This can be due to denial. This can be due to lack of negative consequences, so the behavior for them is still really positively reinforcing, so there's really no push to make a change. This can be really, really difficult for family and support members because during this period of time, the addicted person is not going to be receptive to interventions. They're not going to be receptive to information-based or being confrontational with them. So it's really important for the support members to implement self-care for themselves, as well as setting appropriate boundaries. And appropriate boundaries in this stage could be things such as no longer giving money to the addicted person, no longer allowing them to stay in their household. And so sometimes with these appropriate boundaries, there's going to be some negative consequences for that. The addicted person is not going to be receptive at first. They're going to be very angry. And that's normal, but a lot of times with setting and sticking to these boundaries, it actually will help the person move into the second stage of change, which is contemplation. So contemplation, the addicted person is now starting to recognize that they are having, this is becoming a problem for them. They maybe want to make a change, but they're not really sure where to go. People can stay in contemplation for a very, very long period of time. A lot of times the addicted person knows that they have a problem way before they decide to change it. So for the supportive side, an appropriate intervention during this period of time could be information-based interventions. So maybe, reading up on addiction and therapy and just kind of opening that door for them of, hey, I read about this, this is where we're at. It's really important during this period of time for non-judgmental interventions. So information-based, but we won't want to be judgmental. And so contemplation moves into the next stage, which is preparation, and sometimes this happens really quickly. So for the support person, if an addicted person comes to you of saying, hey, I don't want to do this anymore, I want to get into treatment, it's really important to take that seriously and jump on that. Sometimes that window is a little bit short. So during this period of time of preparation, the addicted person, it is your responsibility to start looking up treatment centers. If that's something that you want to do, start making a plan of, okay, I want to do this, so this is my first step. This is what I need to get in place. If you're going to inpatient, it's important to talk to your job. If you have kids, it's important to line up childcare for them. And so the support person, this can be an appropriate intervention for you of recognizing any barriers for the addicted person and trying to help out as much as you can. And so during preparation, we're just doing a lot of things to just set up this change. So the next stage would be action. So we did all of our preparations, we have everything in place. Action begins when we're actually starting to change this behavior. So this could be starting with inpatient, it can just be starting with cutting the dealer off, anything like that. We're really starting to make the change. During the action stage of change, it's important for the addicted person to be consistent, to follow through with your plan, to just make sure that you're checking in with yourself of, are there any barriers that are more difficult for me that I didn't recognize? The support person, this is really where you can set up of, just being supportive of checking in with the person, making sure that they're doing well, and following through with their plan that you guys set in place. So, during this period of time, it's important to work on stress management, identifying triggers, high-risk situations, working on co-occurring issues such as underlying trauma. Sometimes people don't have mental health prior to addiction, but it's really common following taking substances out of the equation to have symptoms related to depression and anxiety. So it's important to also work on interventions with those pieces as well. So, action stage lasts for a pretty long period of time before moving into the next stage of change, which is maintenance. Typically, this is 6 months of consistent behavioral change. And I say consistent behavioral change. So this does not also automatically mean no substance use. Obviously, that's a really big piece of recovery, but it's also making sure that you're making behavioral changes as well. So this could be, being more mindful about being truthful and being honest and following through with plans, things that a lot of times in addiction get lost. So maintenance stage of change of 6 months plus of consistent behavioral change, it's still important to recognize that just because you've been clean for 6 months, there's still work to do and still being consistent. During this period of time, the addicted person, it's good to check in with yourself of, okay, what's working? What was I doing before that maybe I'm not anymore? Of just being really mindful and honest with yourself of, okay, I'm starting to slip, like this isn't working for me anymore. What do I need to do? For the support person, it's really good to just, again, check in with them, be supportive during this period of time. So on the stage of change, and I don't want this to be misinterpreted, but relapse is on stage of change. Not everybody that makes a change relapses, so I don't want that to be misinterpreted. But relapse can obviously happen, so for support people, it's really good prior to maybe a relapse or maybe you recognize some behavior changes. It is appropriate to be confrontational during this time, but we want to be confrontational without being accusatory. So this could be of, hey, I noticed when we talked about some of your high-risk situations that this is one, and I've noticed that maybe you've been doing this a little bit more. I just want to be here to support you if there's anything going on. So this opens up for the addicted person of knowing that you're there and that you care about them, but you're not accusing them of relapse. And for the addicted person, if you did relapse, recognizing that we can start making a change and kind of get back on track. So it's important to recognize that if relapse happens, that the addicted person can go back into either pre-contemplation, contemplation, or preparation. So depending on where this person lands, the supportive person goes back to the original interventions. If a person relapses and they are now back in pre-contemplation of I don't have a problem, supportive person, appropriate boundaries. So I hope this is really helpful for you. I truly believe that addiction is a multi-dimensional approach, so family and support people are crucial in addictive recovery. So it's important for both sides to have an understanding of where the person is coming from. I hope this was helpful for you. If you are in recovery, I applaud you. If you are struggling with somebody with addiction, it's also appropriate for you to get help as well, because this can be a really, really difficult time for a lot of people. All right, thank you so much.